Let's go ahead and welcome our first guest, Dr. Brian Evans, President and CEO of Dignity Health Sierra Nevada Memorial Hospital. Welcome, Dr. Evans.
Thank you, Aubrey.
Let's get right to those questions. Is there pressure to get back to normal? Are we moving too quickly? What do you think?
Well, I think there is pressure. Certainly from the hospital point of view, we're feeling pressure to get back to some sort of recovery, some sort of normalcy in what we do. But I think the pressure is being felt by everybody. If you're a small business owner, if you're just trying to get back to a normal lifestyle, if you've been affected economically by this, and so many people have, I think there's a tremendous amount of pressure. And certainly here at the hospital, we're feeling pressure to really get things going again, doing our elective cases that have been deferred for a long period of time. We're also feeling just the pressure because we know there's a lot of patients out there who have deferred things that they need to get taken care of. Maybe they've got a knee that is very arthritic and painful, and it's very hard for them to be mobile. That's something that needs to get taken care of. And so we want patients to be able to get the services they need. So yeah, I'm feeling like we want to get back to normalcy as quickly as possible, but we have to do that in a safe way and make sure that everybody is comfortable and taken care of.
Yeah, I'm sure many, if not all of us, can feel pressure in some way of just the gravity of the situation. When it comes to businesses, do you have any advice when it comes to reopening?
Yeah, I think that what's happening now as we go into this sort of phase 2 recovery mode, most of the counties are really trying to get that process accelerated back into phase 2 so retail and other businesses can reopen in some fashion. Everybody really wants clarity about exactly what they should do and exactly how to set up their business, where people should stand, how they should deal with transactions, et cetera. And I think there is pretty decent guidance on a lot of those specifics from the counties and from the state. But ultimately, every business is a little bit different, and you're going to have to really think about it from the standpoint of the business owner, the employees, and the customers coming in, exactly how we can all work together to protect ourselves. I think ultimately it's going to be about common sense. If we all really think about what is going to increase our risk of getting infected and what's going to decrease it, we just need to really think about all those things and make good decisions.
Yeah, safety definitely top of mind for so many of us. Now, testing is still something that's out there. People still have questions about it. What is the quickest way to get a test if someone wants to be tested?
So there's more options now for testing than there were before. If you recall at the very beginning of this whole pandemic, it was tough to get a test. And if you did get a test, a lot of times the turnaround for those tests was quite a long period of time. It was like a week in many cases. So now there's more options. You can certainly go to your doctor, and most physicians are able to order a test through one of the labs like Quest or LabCorp, those types of things. But now we also have another option where the state of California, working with the counties, has put up testing sites in many communities, including Sacramento, where you can go and get a test. And you can usually go to your county website and make an appointment. You can call in or you can register online, and then it's through a company called Optum. And even folks that have absolutely no insurance can get tested, and it's covered by the state. So I think that's a pretty good option. I understand the turnaround times for those have been about 2-3 days, and that may vary depending upon the location. But I think that's been a big help for getting folks tested. So I would recommend people do that. Certainly hospitals have more testing now. We at Sierra Nevada have testing capability here where we can test folks that are in the emergency department or inpatients, and we can get those test results pretty rapidly, often within an hour or so.
Well, that's definitely good news, good information. One of the things you should not be leaving the home without is a mask. Explain again, when should people wear this mask, and do they need one when they're in the car?
I've gotten that question a lot about, okay, should somebody be wearing a mask all day long? What if they're driving in their car? What if they're riding their bike? What if they're jogging? That kind of thing. Again, I think that we're going to need to use some common sense here. For the car, if you're driving in your own car alone and there's nobody else in there, and nobody is going to jump in the car in a few minutes and drive around with you, then you probably don't need to be wearing a mask. So I've seen folks driving around with masks on, and I always wonder, are they picking somebody up that they don't want to expose? Are they trying to not contaminate their car environment? And really, you could contaminate your car environment, and if somebody shares the car with you, then it might be reasonable to wear a mask in there. But if it's just you and nobody else is going to get in there, I don't think it's necessary. Similarly, if you're outside, you're by yourself, you're running, you're on your bike, I think it's probably not necessary to be wearing a mask. I think there's a theoretical risk that somebody coming along behind you might be breathing your air and that kind of thing. So, it's just hard to imagine that that's a high probability event. So I think we need to use our common sense. If we stay 6 feet away from people, especially if we're talking to them for an extended period of time, and we're sort of sharing airspace with those individuals, you definitely want to be wearing a mask in those kinds of situations. If you're indoors, the risk is going to go up. Certainly better off in a well-ventilated indoor space, but being indoors is not as safe as being outdoors typically.
Good to know.
Yeah, with masks, we have to use our brains. We got to think about every situation we're in and how likely is it that I'm going to either be giving somebody an infection that I don't know I have or getting it from them.
Right. Well, keep your mask handy just in case you do need it. When we talk about treatments, doctor, what are the treatments that are available for COVID-19?
So this has been really interesting because I don't recall a situation where we had a new diagnosis or new infectious disease come along, and there was so much effort and so much work being done to do research on medications and other treatments, vaccines, and that sort of thing on something like this so rapidly, just so much energy being put into it. And some folks have been actually critical and saying, well, why aren't there more medications out there that can treat this? Why aren't there like antibiotics for this like right away? And so first of all, this is a viral infection. So a lot of different things are being looked at to see if it's beneficial. There are studies being done, but it does take a long time for those studies to either show benefit or no benefit, depending upon what it is. So there is some positive news coming that it looks like remdesivir, which is an antiviral medication, is likely to be beneficial in folks who are relatively ill, so people in the hospital. And the studies preliminarily are showing that it actually reduces how long people are in the hospital if they take remdesivir, if their doctors are giving them that. So that's good. But I think that there's a lot more research that needs to be done on remdesivir and other antiviral medications. The other thing that's showing some promise is convalescent plasma therapy. So if somebody has had an infection with COVID-19, typically those individuals are going to develop antibodies to the infection, and those antibodies potentially could be used in another patient. So you can take somebody's blood who's had the infection and recovered from it, separate out all of the plasma and take that plasma with the antibodies and then give it to another patient. And there is some preliminary data that shows that is helpful. Again, more study needs to be done. But we really need to be cautious whenever we're looking at new medications and new treatments for an infection like this, because we don't want to give something to a patient and make them worse, have side effects, etc.
All right, well, that sounds like a little bit of positive news there, so I will take those positive updates. Dr. Brian Evans, thank you so much for joining us this morning.
This interview involves commercial content. The products and services featured appear as paid advertising.